Shabab, so the growth spurt which is happening at the time, yeah, it is a result of gonadarchy, isn't it? Okay, it's an expression of the gonadarchy. Gonadarchy means gonadal hormones are coming, and these hormones are causing a rapid increase in the height, males and females both. Okay, all right. Changes in the habitus. Our habits also change. We'll talk about that. Secondary sexual characteristics. Males change in their habits. Females change in their habits from the childlike to the adult-like, and we'll talk about the behavioral changes which are happening also. Okay? Menarche, you know the meaning of the word menarche, all right? You know axillary hair development. It means we are breaking down the terms, we are understanding when it is happening. Okay? So it is a part of pubarchy, you can say that, isn't it? Axillary hair development is a part of pubarchy, which is a reflection of adrenarchy. So both adrenarchy and pubarchy are giving you pubic and the axillary hair. Awwal adrenarchy, and then results in pubarchy, and that is the phase. Okay? Adult breast development. Okay? This is also thelarchy. The first term which is written is the beginning, when you just start the breast. And adult breast formation, I said for few years it will continue, and then thelarchy, it's finished, it's over. Okay, thelarchy is at that time, but this phase continues, and complete breast development will finish after few years. Okay, it will not happen in just 6 months or 1 year. You will see the time frame also. Let us see the timeline. So tartib is given here. Let us see which one is coming first. Breast development in a girl's breast development is the first thing which starts at the time of puberty, when the puberty is beginning. Okay, the first change is breast budding, and the age is somewhere between 8 to 9 years. Slight change in the breast. Okay, from a girl like rudimentary breast, slight elevation or slight swelling starts, very little, which is very mild really. Okay, and goes very slowly. Then at the same time, taqriban at the same time, following it or at the same time, you have started another characteristic, and that is the development of the hair. Okay, and that is also an early development in a female. So thelarchy and pubarchy are going together really. Okay, but look at the timeline which continues for a longer period of time. Oh yes, because pubic hair, the breasts are developing for about like 4 to 5 years. Okay, it's not 1 year. Can you see the time frame? Okay, it's just happening for 4 years or 5 years, sometimes early, but usually takes time. Okay, complete breast development, from if it's starting from 9 years, then maybe it will take up to 14 years or 15 years to develop. 4 to 5 or 6 years sometimes are required for complete adult-like breast development. Okay, because every month hormones are acting and they are constructing the breast, the changes are coming, and these changes are slow going changes. Pubic hair, if you see, they are going for a little longer time, because their distribution, their pattern, initially little amount of hair, thin sparse hair develop, then they become thicker, then they spread, then they become dense, then they extend over the external genitalia. It means final development of the hair in females, even in the males, they will take time really. Okay, it will not be easy like in 1 year or 2 years. They take 4, 5, 6 years. We observe ourselves that if the body hair are growing, every year there is some change in the hair development, and this continues even up to a very late stage of life, not even puberty. Mashallah, you have passed through the puberty, but you will observe yourself that further density of the hair over your face, over your chest, over your rest of the body will happen slowly, more and more and more. Even at the age of like 20s it will go on like this. Okay, so it continues, it will go on and on and on. So it's a long phase of hair development, not a short phase. So pubic hair will take time, it will take many years to develop. Okay, it continues a little more. Growth spurt, let's see, growth does not start at the same time, at the just initiation of the puberty. The growth spurt is due to the hormones estrogen mainly. Okay, growth hormone is already maujood, but now growth hormone is supported very well and actually dominated by estrogen. So the dominant hormone now is, which is acting on the skeleton, on the linear growth of the bones, to stimulate the epiphyseal plate, to increase the laying down of the cartilage, to increase the bone formation. All this is done by estrogen, primarily estrogen, supported by the other hormones, metabolic hormones, okay? So that continues, that comes late. If it is starting here at 8 years or 9 years, then maybe a year later, 10 years or more, then the height of the girl will increase, okay? So elongation, growth spurt, okay? And that's a very quick growth spurt at the time of puberty. One growth spurt occurs when we are 1 year to 3 year, 4 years, and all of a sudden growth occurs, okay? That growth spurt is due to the growth hormone and thyroid hormone at that time, a combination, okay? But the second growth spurt at the puberty is due to estrogen in the females and testosterone in all of us, okay? Look at the habitus changes. Is habitus change or changes starting right from the beginning or a little late? What do you think? It's coming late. The psychology is developing. In the beginning, the girl is physically developing, but mentally she is childlike really. She doesn't understand many things, okay? Same is the case with the boys, even though they are developing, but they don't become mentally mature or psychologically mature. It takes time really, okay? So all those changes are expressed a little later. Psychological changes or the emotional changes which are developing, okay? Look at menarche in the girls. Menarche. What do you think? Kya? Menarche. Menarche. Look at the graph and tell me. What time is it starting? It's not there in your mobile, it's there in the board. We are discussing this slide. We are not discussing anything which is there. So, you can have a look at the menarche. Axillary hair, a little earlier than menarche or after menarche? What do you think, and compare axillary hair with the pubic hair? What do you think? Which starts earlier, axillary or pubic? Pubic. Pubic appears first and then axillary. Axillary hair, both in males and females, they appear a little later. Before that, the pubic hairs, they start showing themselves really, okay? And later. And then they continue, both actually. Adult breasts, okay? We are talking about the characteristics of the female hair only. Adult breasts. How much time is being taken total? How many years do you see? Yeah, it's not really, if you see the span, it takes more than 5-6 years really, isn't it? More than that time. Maybe sometimes in few years girls can complete and they remain same. But most of the girls, they keep on developing over 5-6 years and then they stop. And then there is a fluctuation I was saying. Every month the breast will change. When estrogen, progesterone come in the cycle, they change the breast size and they change the physique of the breast. They becomes a little heavy, tense, and again they go back to normal. Then in the phase of pregnancy, they change. Then at the phase of menopause, they change. So breasts are not the final stable tissue. They keep on slightly changing their shape and internal structure according to the requirements. Okay?
Does it represent the expression of the hypothalamic?
Yeah. See, all these, okay, all here, the hypothalamic axis has started here actually, okay, at this point. Very slowly it has started showing its sign, okay, yeah, but the true manifestation of this will happen somewhere late, a little after that, okay, so that you have other characteristics. If you don't have hypothalamus starting, then you cannot have adrenarche also. Possibly adrenarche is stimulated by hypothalamic pituitary system somehow, and some special hormones or chemicals from hypothalamus pituitary system are stimulating the adrenal glands. Okay, so there is a tartib of events, but hypothalamus again takes years to become maximally functional. Okay, it will not start in one day. It starts and goes and goes and goes and goes, and then it becomes maximum or most effective. Yeah, hypothalamus. Yeah. For all these changes, hypothalamus is started with a very little work. It starts. Okay. All right. So we are familiar with the terms, Shabab. All of these terms: adrenarche, pubarche, menarche, gonadarche, and thylarche. All these terms are clear to us. You have seen the relationships also. Okay. Okay. This is a graph of girls. What do you think? The height of the girl stops earlier, or the hair growth of the girl stops earlier? Estrogen. Okay. Estrogen is responsible for the height. Androgens are responsible for the hair growth. Androgens will continue their work. It's a slow process of developing and remodeling here. And height is very quickly stimulated by estrogens and quickly stopped also for after few years, because estrogens have very special property to stimulate the bone early and to finish the job early also, acting on the epiphyseal plate, please. Okay, so keep it in mind. These are the changes, stages. These are the tenors, stages. The scientist or the person who studied and compared male and female, how the changes are developing. Okay, it's basically slight elevation of the papilla, not the whole size of the breast is developing. Then definitely when estrogen starts working and priming the breast, overall shape of the breast is now showing itself slightly. Areolar change is coming. Gradually over years, further enlargement, and I say this is a slow process. It is not happening in 6 months or 1 year. It will take time really, okay? So give it time. Then final shaping, secondary shaping of the areola is happening and the papilla developing, and then final readjustment of the breast shape. In that, breast is determined. The shape is variable, but still the final development has to occur within like 5-6 years. It will take time. Okay, this is prepubertal. This is about like between 9 and 13 years variably. Usually this time is for this stage, and by 17 years or so in most of the girls this formation is completed. You are considering the whole world population, that's why you are giving the time range. You can't put the same time for every girl. It is different, isn't it? Genes are different, geography is different, external factors are different. So many factors are operating and they are determining it. Okay, you don't have to remember all these ages and you don't have to really see. I'm just telling you how irtiqa is happening, evolution is happening in the growth. Okay, every year changes are coming like that, just in order to see physiologically and structurally. Okay, this is also tenor staging. Okay, and the same thing is written here, and at the same time the pubic hair development is also given, that in stage 1, when the breasts are developing in stage 1, at that time there is no pubic hair. Okay, and when you go through stage 5 is there, when adult breasts are done, finally 16-17 years of age, at that time maximum density of hair is about to be finished. But you remember one thing from the slide also, hair development will continue even longer. Okay, it will grow even longer, maybe a year more or maybe more. Okay, you have seen that. All right. Usually 2 years maximally. Most of the girls, they don't grow very long. Okay, and if they grow as they start the cycle, menses. Within 2 years to 3 years of menses, they attain the height within 2 years, and then if you watch them, they will not grow further. They will have changes in the breast, in hair distribution, in psyche. All functional changes will come, but height will not increase. Height stops. Boys start slowly. Boys will start at the age of like 13 or 14. and then they continue 15, 16, 17, 18 up to years, or maybe, so height in the boys can continue up to 4 or 5 years. Some boys start very late actually and then they grow. Some start early and they continue. There is a variation in the growth of boys, but the phase of boys is overall tawil, because of estrogen is not there. It is testosterone which is causing it. Okay. The ossification happens at the time of, once the height is attained in the girls, at that time ossification, the wrist joint shows the fusion of the bones. Okay, the distal ends of the bones, radius, ulna, if you see, okay, these bones, they fuse. Okay, here you will not see them as separate like this. Okay, they will fuse and will become one. Once the fusion has occurred, now the height will not increase. Okay, so the best indicator is the wrist x-ray. Usually left wrist joint is taken, and that is the sign of seeing the fusion or epiphyseal fusion, final formation, and cessation of the height. Okay, so this x-ray is important. If there is a gap present, it means there is still a chance of further growth, isn't it? Growth hormone, thyroid hormones, all are acting, but on top of the list, the most important hormone for this growth attainment at this time is estrogen in females and testosterone in males. Okay, that's okay. We have had enough of the menarche. We know what is menarche and what factors. Okay, we also talked about menarche is not very functional. After menarche, female is not very functional reproductively, in the sense that fertility is not very good for the first year. You know the reason why. Okay, and after that, it's alhamdulillah very well established. Okay, so if a girl is married immediately, we have a culture right from Qadim ages that girls were married at the first evidence of their menstrual bleeding. Okay, the parents used to wait, and once the sexual maturity was attained in the form of, it used to happen in Muslims also, in all over many parts of the cultures, even in non-Muslims, many places, old ages, it was a practice. Okay, so at that time, even if the girl was 9 years or 10 years, and if she had started menstruation at that time, she was supposed to be ready, and actually she was ready. Okay, because the changes have occurred. Mentally, maybe she was not ready. Okay, mentally, because it takes some time. Okay, mental maturity may be a question mark, but physical maturity has been attained, and she can get married at that age. So usually if the girl is married at that age, the chances of having pregnancy, early pregnancy, are a little delayed. Okay, it's not that in the next cycle or in the next month she will have definitely the pregnancy. It's not like that. Okay, so it takes time, because the internal adjustments of the system are happening for 6 months to 1 year, and then, well, I'm not saying that even for the first time in the first cycle it is mumkin. It's by Allah actually, because the process has started, and mumkin ovulation can happen in the first cycle also. Usually it does not happen very correctly, but it is a possibility. Sometimes the girls who were married at the age of like 10 years, starting at their menses, they used to have babies within like 2 months, conception in 2 months or 3 months only. Okay, very quickly after the marriage, and they had their first baby at the age of 10 years or 11 years, no problem. So it is mumkin, but usually, okay, there is a physiological delay, and we know the reason why. Okay, there is no problem in the system. System is just initiated, it is waiting for its correct time. No problem for pubic and axillary hair, ovarian development. For boys, we all know that. Let us quickly talk in few minutes about the sexual characteristics and then go over. Okay, I'll not prolong the discussion, it's very simple thing. Okay, for the boys, we know ourselves, we have been through all these stages. Okay, we have passed through. So if we collect all those changes and making a set of secondary sexual characteristics, okay, what changes have you observed or are happening at the time of puberty? Abdullah, yeah? Enlargement of the testis is the first change which is probably not observed by a person who is passing through the puberty, but if scientifically you have to know the evidence, the enlargement of the testes, the change in the size of testes from the childlike testes to a little growth, a quick growth of the testes is happening before the growth of the penis and scrotum. Yani from the external genitalia, their growth will come later, testes will enlarge first. That is a very correct answer. Yeah. And at the same time, we all have experienced that the voice quality changes because of the heaviness comes. It's laryngeal enlargement, isn't it? The larynx is changing, the size of the larynx is increasing, the mucosa is changing, hypertrophy, and epithelium is modified, overall hypertrophy, and that's why the quality of voice changes, definitely. What else? Yeah? Facial hair distribution. Now look at the hair distribution. We all know that variably in all of us, less or more, hair distribution has to happen. Okay, facial hair, axillary and pubic hair, these are the typical characteristics which have to happen. Okay, not equal in all, it depends on genes and the receptors and the hormones and the sensitivity. It is quite variable in all of us. It depends on our genes, our ancestors. And even in the same family, you will see not all the brothers will have the same kind of growth of hair. Okay, it's not lazim. It's not, because it's about your genes that you are getting, how they are encoded. We are different. Even in the family, we are different, from same mother and same father, and we are not same. Okay, so it means the patterns are different really, but we have to pass through all these stages. Okay, so hair growth is there. Additionally, for the males, variably, again depending on our genes, we'll have the hair growth on the body parts like abdomen and like the chest, which does not happen in the female. Okay, there is no usual pattern in the female. Rarely females can develop, if they have some sensitivity or receptors, they can have hair growth on the body, especially for the legs and for the arms. Okay, and sometimes even some hair sparse distribution can come. It depends on their receptors. If they have more receptors genetically, if their hormones are more androgens, unfortunately they cannot do anything, and they are very disturbed also, girls, because cosmetically it is very disturbing for a girl to have extra body hair, isn't it? For boys, it's okay, there is no problem. It's a gift of like being a male, but not for the girls. Okay, they don't like it at all. It's away from their aesthetics. They're not made to be like this actually. Okay, so when extra growth is there, go for the reason physiologically. You say, okay, either they are producing more adrenal androgens, or their sensitivity of the cells is more, maybe the receptors. It means some genetic coding is a little different, and that's why they are getting this problem. Okay, males and females, they develop a different pattern of hair, and that is also interesting to know. And yeah, it's there. All right, please look. I'm drawing. I'm drawing hair pattern, hair distribution. Okay, look at this hair distribution. I'm sorry, this is red color I'm drawing from, you cannot see clearly, but I have drawn a triangle, musallas, you can see that, okay, like this, a triangle. A triangle which has a base, a broad base, and a narrow apex, and that apex is being extended up. This is abdomen, okay, this is the area of abdomen here, okay, and this is the pubic region, alright. Now look at this triangle. Look at the shape and look at the size of the triangle and compare which one is male and which one is female. Our pattern is the triangle having a broad base and a narrow apex and a tailed apex which is going up, because hair are variably coming up along the linea alba, isn't it? They will have to grow with age and years. This is the male pattern, okay? But for the females, it's opposite. It's covering the pubic region and the external genitalia. A dense hair growth is there, but it is a triangle with the base upwards and the apex downwards, isn't it? So this pattern is called male escutcheon, okay, ESC, okay, it's a very strange kind of word. Male escutcheon is the name given to the pattern of our hair. How our pubic hairs are distributed in males, okay, with a broad base facing downwards and an apex towards the upper side. And just opposite to that, if the base is upwards, if the apex is in the females, okay, apex is down and the base is upwards towards the abdomen, then it is known as the same word, female escutcheon, okay. Male and female escutcheon is the pattern of the hair which is there, all right. These are the stages how the testes are developing. I don't want you to memorize all the stages, but these are P1, P2, P3, P4, P5. It's for the development, the penile development, the development of the penis. Testes develop early, penis develops later, follows, and there are development. Finally, the hair growth which happens in the males on the genitalia, around the genitalia, pubic region, okay. In the final stage, the hairs are spreading on the medial surface of the thigh also. They are going up over the abdomen. They are in the pubic region from before. Now they are becoming dense, more thick, less sparse, and finally what happens, they also have their growth on the medial surface of the thighs in the final stages, okay. In the male secondary sexual characteristics that we are developing, male, tell me one thing. What kind of behavioral change do you see in the males? As males, what change have you observed in you when you were a child and now you are, mashallah, an adult, okay, having passed through the time of adolescence? Yeah. Sex drive, okay. A normal sex appeal or a drive develops. It's a sexual attraction towards the opposite sex. This is one thing, okay. This is natural. It has to happen. So it means a sexual orientation. Normal sexual orientation means it's an attraction, natural attraction towards the opposite sex, okay. This is one of the instincts that we have, that we are growing with. True, very true. What else? No, I'm saying behavioral change. Muscles are not behavior, okay. What kind of change? Aggressiveness. Thank you, Ran. We become aggressive also, okay. Difficult to control our anger. We try to fight with each other, or we become loud very easily when we are arguing, really, okay. That happens when we have grown up. It is the gift of testosterone, really, isn't it? Which is changing the psyche also, androgens, okay. So it's easy. We become flared up very easily, okay. At all levels, really, we can fight very easily. Boys and boys, or with any conflict that is there, we can express our anger and aggressiveness very easily. Even when we are playing, we become more aggressive in play also, okay, at the same time. So at all levels, you see, we don't note it, but it is there actually inside us. We have changed, really. We are not the same, okay. What else? You also become more active and more motivated in many aspects of life, actually, okay. You have some motivational changes. You become active towards some goals of life, okay. This is changing now. You are redirected towards few things, actually. So generally you become more active for various aspects of life. You develop a sexual attraction. This is another thing. And you have an aggressive behavior. Okay, I'm not saying that you start killing others, but still aggression is there as a part of our personality, okay. Variably, some have more, some have less. It depends on our genes and our psychological upbringing, many things, but it is there, okay. Yeah.
Can you explain that this is feelings by hormones?
Where? Yeah. See, sex drive, positive feeling means motivation.